Welcome to the first EFY Health and Wellness Lunch and Learn. We're so glad that you chose to spend a little bit of time with us today. My name is Carol Birchenbiter. In 2020, the prediction is that an estimated 276,500 women will be newly diagnosed with invasive breast cancer. An additional 48,500 will be newly diagnosed with non-invasive breast cancer. And approximately 2,500 men will receive the diagnosis of breast cancer in 2020. These are staggering statistics. The good news is that since the 1980s, the death rate for breast cancer has decreased by 50%. With Breast Cancer Awareness Month right around the corner in October, we wanted to have a discussion today about breast cancer prevention. With us is Jennifer Somerville. She is a nurse practitioner with the Hall Prime Cancer Center. And I just wanted to welcome you, Jen.
Thank you. I'm glad to be here.
So good to have you. So Jen, I just wondered if you would tell us a little bit about yourself and about your role at Hall Prime Cancer Center.
Yes, I work in surgical oncology alongside Dr. Reed. I also assist in surgeries as well. I have found that there is just an amazing amount of patients that come and are so strong when they have that diagnosis. But what we want to do today is kind of reduce some of the statistics that we're going to talk about and empower people to do that.
Absolutely. And Jen, can you just tell us a little bit about you personally? Do you have a family? Do you have children?
Yes, I have a Spitfire of a daughter. She's 3 years old. I have an amazing husband. And as we'll kind of get into today, friends may call me a little bit of a health nut. I like to talk about nutrition. I like to work out. However, I do love my cookies.
Good to know.
But I think what we're going to talk about a little bit here is just giving people some tools to change one thing in your life can impact these statistics that we're going to talk about and empower us.
Absolutely. Well, thank you for that. During 2020, I think we've all felt a little bit out of control over so many things. There's been COVID and social unrest and the local derecho. Breast cancer affects so many people, and there have been some improved statistics because of new treatments and new technology and all of that. But so many times I feel as though we think that we have no control over those really hard things that come into our lives, and some of those really difficult diagnoses are some of those things that I think we feel very out of control with. So since you and I have been having these discussions, Jen, you've really helped me to come to a better understanding of a few things that I actually can control, and I like that idea.
Good. That's exciting. That's the goal.
Absolutely. Yeah. And so I think that what you said a minute ago is so true, that if we can come away with one new thing, one thing that maybe we didn't see in the same way, one thing that's just a little bit new to us. I know you brought up some really helpful topics when, we've just been talking about this. And so wellness and breast cancer prevention are just, I think, very hot topics right now. So I just want the audience to know that we do have a chat feature on the Zoom down at the bottom. And so please feel free to submit your questions, and we welcome them. And Jen will try to help us answer some of those questions at the end. Also, so that you know, Jen and I are practicing social distancing. We are in the large Halligan Education Center at Mercy. There are only 4 people in this room right now, although it could hold several hundred, but we are being very careful today because of needing to social distance. And so also wanted to let you know that this will be, Lunch and Learn will be recorded. And so if you enjoyed this and you want to share it with somebody else, please know that it'll be on the EFY website right after this recording. And so we would love it if you would share that with other people who might benefit from some of this experience or some of this information. So Jen, share with us, what can we do to fight the statistics and to take back control of our lives?
Well, I'm so glad you asked. Let's get into this presentation here. So we're going to talk about what we can do to empower ourselves to prevent breast cancer. Breast cancer is the most common malignancy among women in the United States. Aside from some common skin cancers, this is the most common malignancy. And so with that, this is a very relevant conversation. So breast cancer risk increases as we age. Median age is 62, meaning 50% of women are less than 62 and 50% are greater. Surprisingly, I think maybe to the audience, is that 50% is less than 62. That's young. 1 in 8 women will be diagnosed with breast cancer during their lifetime. That's roughly 13%. That is a huge, scary number that today we are going to work to decrease.
Good.
So, hereditary cause of breast cancer. A lot of us think, oh my gosh, we need to screen for the BRCA gene, or it's only 5 to 10% of breast cancers that are caused by certain inherited mutations of genes.
Now that is a really surprising statistic to me, because I think so many times I felt as though I don't have breast cancer in my immediate family, in my bloodline, so I'm not at risk. But that's really not true, is it?
No, and the good news is that that is a risk we cannot change. So if we do have the 2 most common genetic mutations that cause breast cancer are BRCA1 and BRCA2, but that the rest of the causes of breast cancer we can affect to a degree, which is empowering to know. So, you know, women with a first-degree relative, mother, sister, daughter, those are ones that have a greatly increased risk, and definitely need to be aware of that.
So I'm sure you're going to talk about this in a bit, and maybe this will actually come up in the next one, but there's a younger age then, is that what you're saying, that women should be screened if they have a hereditary gene?
Yes, definitely. So screening for breast cancer, this is something that we need to do because with our risk, as we talked about, it is important to screen. Before we get into prevention, we're going to talk a little bit about this. So it's recommended to begin mammogram screening between the ages of 40 and 45. There's multiple different organizations that recommend about that age range. We'll really get into different reasons for different ages. Our next presentation will be specifically on screening and treatment. But it is important to talk with your primary care provider and say, you know, am I average risk? Meaning I don't have a family history, I don't have a genetic risk, I haven't had previous radiation to my chest. And those are the things you really want to talk about as far as average risk. But if you do have more than an average risk, you really want to make sure that you talk with your healthcare provider, regardless, to make sure that you have an individualized plan for screening based on the guidelines that we'll talk about.
Well, and I think one thing, you know, I think there was a generation that didn't talk a lot about things like this. And so maybe just to ask, you know, your grandma, your aunts, is there anything in our history that maybe I need to know about that I wasn't aware of as far as breast cancer goes?
Yes, yes. And I think it's important to note that during this pandemic, don't hold back on screening for anything, including breast cancer. As far as coming in, getting that mammogram, this is a safe place to come. This is a special circumstance between me and you when we're not wearing masks, as we talked about, but everyone here has been educated to be an expert in preventing the spread of infection and COVID. And so this is probably one of the safest places you can be.
I'm so glad you mentioned that, because I think so many people feel as though the hospital and healthcare organizations are scary places. And I noticed that among my friends that, you know, they didn't want to go to the doctor. They didn't want to go to the hospital because we have germs that they don't want to get. So I'm glad that you mentioned that. Really, in some ways, the hospital and healthcare organizations are safer than maybe the grocery store.
Exactly, exactly. Yes. So self-breast exams, we're gonna get into the nitty-gritty here. We should all be doing self-breast exams monthly, if not more. It's great for us to be familiar with how our breasts are normally. It's so, so important. So, you know, let's talk a little bit about, you can do a breast exam with your partner. That would probably be pretty fun. I think most of us would enjoy that, including our partner. But so just a couple of facts. Our breast exams, if you're still menstruating, should be done within the first week of your cycle, just because the level of estrogen is a little bit lower. And if you have more fibroglandular tissue, it can.
So tell us a little bit about what is that? Fibroglandular.
So it has to do with your lobules and ducts in your breast. And those are part of the milk making process after we have babies. But those respond to estrogen and progesterone in a certain way that can enlarge those certain structures in our breasts and make it feel as though we have a lump. So some of us in the audience here, maybe, oh yes, I do get a little sore towards the end of my cycle. I get a little tender. I feel like maybe my breasts are swollen. Some of us may even be telling our partner, can you just relax a little bit? So what we need to know is that maybe a little bit more lumpiness towards the end of our cycle, if we're still menstruating, can be normal as long as it changes, as long as it decreases and goes away. If it stays, definitely time to get it checked out. But this picture shows a couple of different techniques. It's important to be very uniform with your breast exam. You want to go all the way up to your clavicle. There's breast tissue all the way up to your clavicle, so our collarbone, all the way down to that fold underneath our breast, all the way to our breastbone or our sternum, and then into our armpit. So we really need to be aware that our breast tissue is a lot bigger than probably most of us think. And so covering that area, whether you do circles from inside to out, whether you go horizontal or latitude, it's just important to make sure you cover that whole area.
Well, and you know, I think you made a really good point that your partner should also know what's normal for you. Yeah. Because I have heard from friends that sometimes it is their partner that discovers a lump. And so that's important for us not to neglect that opportunity to have yes. somebody kind of double check us and say, yes, okay, is this what I'm really, am I just making this up, or is this really there?
Yes. Yeah. Yeah. I mean, make it fun.
Absolutely. I mean, it wouldn't have to be limited to once a month, right?
Oh, absolutely not, Carol. Absolutely not.
All right. Good to know.
So this is another intriguing slide. In talking with my husband about this presentation, he was very intrigued by this slide. Yeah. So this goes through some of the examples of things that we would be looking for in our breasts if it were to be abnormal. We're always told, oh, it's a lump or it's a bump. Well, what does that look like? And it's not always just that. So you could feel a thick mass, you could feel an indentation, skin sores, orange peel skin. Those are more indicative of sometimes a rare inflammatory breast cancer or other type of breast disease. Redness, heat, unusual discharge that is not elicited by stimulation of your nipple is to be of concern. Dimpling, bump, as we talked about, you could have a retracted nipple, a growing vein, a new shape, a hidden lump. There's all sorts of things that, this actually comes from knowyourlemons.org. But it's really important for us to know our breasts, know what is normal and what to look for.
Well, and it's good to know that I mean, we do always talk about a lump. And so I think that's one thing that I've really had highlighted since you and I have been discussing this, is that it doesn't have to be a lump. In fact, many times it isn't a lump. It's something else that's just a change.
Sure. Exactly. Yes. So let's talk about some myths that can lead, people think that can lead to breast cancer. These are actually, I think, quite good news. So coffee does not cause breast cancer. It is not associated. Should we do a little cheers? We do have coffee here. Yes. Acidic foods. There's several diets out there that the alkaline diet and different other types of diets that capitalize on that. Our body has acid-base balance down to a science, really. That is not something that leads or is associated to breast cancer. So that's great news. Deodorant with aluminum.
I have always heard that.
Does not lead to breast cancer. There's talk about possibly Alzheimer's and other types of things, but it's not associated with breast cancer. Tight bras with underwire do not cause. Actually, after the treatment of breast cancer, say after a lumpectomy, one of the biggest pieces of advice that we all find ourselves giving in our office is, wear a good supportive bra. And you want to do that to maintain the lymph drainage of your breast so that you don't have excess swelling. So that actually helps us get rid of some of that excess, toxins that our lymph fluid can get rid of. So it's a good thing. Nipple piercings, breast tattoos. Whew, no.
Such a relief. I was going out this weekend.
Radiation from cell phone use. I think a lot of us, myself included, if I'm working out, I'll put my cell phone in my bra and work out. The radiation from that is so small. It's non-ionizing compared to ionizing that you would get from, say, X-rays or an MRI. It's minuscule, and so it does not. It's not associated with breast cancer. Along with breast size, I think. Actually, I just heard yesterday someone said, well, the bigger the breast, the more tissue there is to have breast cancer. It actually depends on the amount of fibroglandular tissue that we talked about a little bit earlier that you have. And we will get into that more with screening in our next presentation, because there's different modalities of screening that you can have if you have denser breasts or more fibroglandular tissue. So,
okay, good to know. All right.
So let's talk about prevention. We've talked about all of this stuff. The biggest key to prevention is our microenvironment. New word here. Microenvironment is the environment that our cells are surrounded by, that they're almost bathed in. And we have the power by our actions through diet, exercise, maintaining a healthy weight, stopping smoking, that we'll all talk about, to control what our microenvironment is and does. Our microenvironment can influence the development of breast cancer cells or discourage the development of cancerous cells or repair some cells. So it's fascinating to know that. So a huge way to impact our microenvironment is by what we eat. Our diet is a huge part. It impacts estrogen levels. Foods high, especially in fiber, help us get rid of excess estrogen, actually in our bowels, in our poop. So eating more fiber is a good part. Blood vessel formation is another thing that food impacts. We don't want tumor cells to have separate blood vessels going to them to increase growth. There's also inflammation and function of the immune system. I think a lot of us have heard that inflammation is just not a good thing for any chronic disease, including breast cancer. So we can eat to decrease inflammation and increase the effectiveness of our immune system.
Well, I shared with Jen when we were preparing for this that when I heard her first talking about the microenvironment of my cells, it was just, all of a sudden, it was just like this light bulb went on in my head, and I thought, wow, I can actually affect my microcellular environment. This is huge for me because it not only keeps me healthy, but it gives me tools to have built in if I do develop breast cancer or some other kind of cancer or some other condition, that I can actually strengthen from the inside. So I love that. It was just like all of a sudden this light bulb turned on when I was going around shopping and on Saturday, and I thought, I have to tell Jen this because this is huge.
And that's the goal. We should feel really excited about the news that we're talking about today, because we really do have the power before we get breast cancer to reduce the statistics that we talked about.
I love that. Yeah.
So
thank you for that new information for me.
So we're going to go over a couple of just key foods. By no means do you just eat grapes, but we're just going to go over a couple of things. So grapes contain resveratrol. I think a lot of us have heard grapes, red wine have good antioxidants and can be good for you. Red wine, of course, in moderation. Resveratrol is a phytonutrient that we'll talk about here. Avocado contains omega-3 fatty acids. Oranges contain limonene. What do you do with this information? Well, these are all special phytonutrients that help prevent and fight cancer. And eating the whole orange as opposed to say, taking a vitamin C supplement, while that can be good, you're missing on that, out on that phytonutrient, limonene or whatever it is, because you're not eating the whole food. So we see a lot of people that are taking, quite a bit of supplements, which is okay, but you really have to be careful. You don't want to end up having just expensive pee. You do end up peeing a good amount of some of the supplements out.
Those water-soluble vitamins.
Exactly.
That's what I heard in nursing school.
Exactly. So eating the whole orange, you get the fiber. So that's a good thing, as we talked about. And you get limonene, which is important to preventing breast cancer. It's actually been shown. So two important points. Supplementation is okay, but whole foods is better.
Great point to bring this up with your children too, to have an orange instead of just eating their gummy vitamins.
Yes.
I mean, gummy vitamins are good, but maybe the orange is a good addition.
As much as my daughter begs for her vitamin, she has, and she does, she has to have the whole food. So phytonutrients, we'll talk a little bit more about that. A phytonutrient is a chemical in a food that provides over and above the nutrition that a certain food can give you. It also helps with a number of things in affecting your microenvironment. So it helps regulate metabolism of hormones, as we talked about, estrogen. And just to go back a bit, 80% of breast cancer is fueled by estrogen. And so I think maybe some of you in the audience may be thinking, well, what's so bad about estrogen? Well, when it gets out of control, when we're not eating properly and doing things to control the amount of estrogen, it can be in excess. And so it can actually perpetuate growth of breast cancer cells.
So are you saying that eating right helps to control that too?
Absolutely, absolutely. So phytonutrients, as we talked about a little, it reduces inflammation, reduces cancer cell growth rate, slows down that rate, stops tumor cells from developing new blood supply, repairs broken DNA, and prevents damage to DNA, and provides antioxidants, which I think most of us have heard antioxidants are a good thing. It stops the oxidation process, which leads to inflammation and stress and more disease.
Yeah.
So it's all linked together.
Yeah, sounds like it.
Yes. So what should we be eating? Aside from grapes, the Mediterranean diet is a really good diet to sort of incorporate into your lifestyle. It contains mostly plant-based foods, whole grains, fruits, vegetables, legumes, beans, fish, seafood. It has low levels of red meat, eggs, dairy products with high fat content. Those are the things that really describe the Mediterranean diet. And here is kind of a picture of just what a plate should look like ideally if we're really eating to prevent breast cancer. Now, 50% of this plate is vegetables, specifically green leafy vegetables, you know, spinach, kale, Swiss chard, other cruciferous vegetables, broccoli, Brussels sprouts. Those are all really good things. I can tell you, my plate doesn't always look like that. It's a very good day if it does. But 25% of this plate is grains and legumes, you know, beans, quinoa, whole wheat pasta. Those are things that can prevent breast cancer. Fruit is included. And then, as I said, less beef, less pork, less eggs, all of these in moderation. Fish and shellfish are much healthier options. They contain omega-3 and so forth. So what do we want to skip? As we talked about with whole foods, it's also good to skip the processed food. So we talk about, I think, Carol, you mentioned kale chips.
Yes. Well, I did ask you if I have to eat kale. I've tried, and I found some things, some salads are really tasty, but sometimes it's hard to make that palatable.
Yes, I definitely agree. One of the things I've found is that if I take some spinach or some kale and throw it in a smoothie, grind it up with some berries, which are also very good and full of phytonutrients, I've gotten a large amount of my vegetable serving, along with fiber, and so that's been an easy way for me. Drinking water is huge, aside from drinking some of the sugary drinks that some of us love to drink, which we'll talk about in a little bit. But so what's the beef with meat? As I said, you have a reduced amount in the Mediterranean diet of red meat. Limiting red and processed meat to no more than 3 portions of 12 to 18 ounces per week, so less than the palm of your hand, which is actually sort of a big serving, I think. Yeah. High amounts of red meat ingestion is associated with a higher risk of breast cancer. There's been several studies that show that, along with a higher rate of inflammation and other chronic diseases, including heart disease. So I think this may be hard for some of us to hear. So processed meat it's bacon. It's salami, it's ham. Red meat includes pork. It includes goat. I think some of us may eat goat. So it is a lot, but reducing is key.
So just a balance, just not completely eliminating my steak that we like to have on Saturday nights. I try to drink a glass of red wine with that, balance it out.
There you go. There you go.
Maybe just add more leafy, beautiful, colorful greens, right?
Yeah, exactly. That sounds like a really great dinner.
Yeah. Well, I love the color in the Mediterranean diet. I love the color on the plate that you showed. I think those colorful foods actually, to me, look a little better than the red meat, raw red meat.
That's pictured on the screen. Yeah. That was the key. That was the goal, Carol.
Yeah.
So sugary drinks, as I talked about just briefly before, you know, on the screen here, you see Red Bull, you see Gatorade, Powerade, orange soda. Those are all, I mean, we have to agree, they taste pretty good. Even the Diet Coke, the diet sodas, we think, oh, I'm being really good. I'm having a diet soda. The sugar in these drinks, along with the artificial sugars, including aspartame, sucralose, and others, it gives you a quick spike in your glucose levels in your body, and then all of a sudden you plummet again, and you're hungry for more. So it is, although these drinks are not associated directly with breast cancer, obesity, which is definitely linked to consuming these types of drinks on a regular basis, is associated with a higher risk of breast cancer. So watching what we're drinking, drinking our calories is just not an ideal thing. Green tea is great. It's actually independently been shown in studies that drinking green tea can make your risk for breast cancer go down quite a bit.
Well, and that would be refreshing after exercising. You know, I'm looking at some of these and I'm saying, you know, Powerade. I mean, when we were cutting up all of our trees, we drank a lot of Powerade. Gatorade is something that people drink when they've been exercising or racing, walking, you know.
Right.
Something like that.
And I think it's important to remember, you know, Gatorade, Powerade, these are okay. Obviously, we want to replace our electrolyte and glucose levels when we're working out, but that level that we should be working out to need to replace that is a very vigorous, high level of intensity. So we just need to watch that.
Food for thought.
Yes. So obesity and breast cancer. Obesity and body fat distribution have both been shown as an increasing, it increases the risk of breast cancer. Also body fat distribution, especially around our waist, is associated with a higher risk of breast cancer. So a higher level of fatty tissue is associated with a higher level of estrogen circulating in our body. And that is why obesity is linked to a higher risk of breast cancer. So a BMI, medically speaking, of 30 to 35 or above is defined as obese.
So how would I figure out what my BMI was?
You can Google BMI calculator and you would enter your height and your weight and it would calculate what your BMI is. Keep in mind, as I said, body fat distribution is more important than BMI or our actual weight, because BMI doesn't factor in lean muscle mass. So we need to be aware of that. You may have a higher BMI if you have a higher level of muscle. Muscle actually weighs more than fat. So it's important to factor that in. But the higher the BMI, the worse the prognosis and mortality rate for both pre- and postmenopausal women with breast cancer. So we're going to talk a little bit about, well, we already talked about food and diet and how that impacts eating food that is associated with the Mediterranean diet, high in fiber, that's going to be more filling, more filling and satiating. And so you're going to lose some weight eating like that. But physical activity and breast cancer are associated independently of weight. So regular physical activity can decreases the occurrence of breast cancer in postmenopausal women, but also in premenopausal women. Better survival after being diagnosed with breast cancer in women who are physically active is found, along with those that have a diet high in fruits and vegetables. And that is independent of body weight, as I said. So you may be of a higher BMI, and you are practicing consistent physical activity and eating a diet that is healthy, and that is helpful. So that's some helpful advice, I think, for some of us that may feel discouraged watching this. My BMI may be this, or I know I'm overweight or obese, and it's food for thought to know that if you're practicing healthy lifestyle actions, then you're better off regardless of your weight. You'll see your weight start to come off when you're practicing healthy lifestyle as well.
I think it's hard though for some people to get weight off sometimes. Absolutely. And get that BMI down. And I know a lot of health plans focus on some of those issues. And so I think this balanced approach to, we're on this continuum of improving our health, improving our exercise, improving our diet. And it's not just, oh, I'm going to be so discouraged because I'm here now and I want to be another place. But you're giving us some really good tools for how do I get there?
Right, right. Yeah. And even if you're not all the way there, you don't have to be. It's always best to do a little rather than discourage yourself and not do anything. That little bit matters. So as far as exercise and physical activity, why is it such a big deal as far as breast cancer risk? So there is an enhanced insulin sensitivity when you work out. What's the big deal with insulin sensitivity? You want your cells to be sensitive to insulin so that you do not have to have such high levels of insulin in your blood. What insulin does is it is released into the blood in response to sugar when we eat, and it helps that sugar go into our cells so that we can use it as energy. If our cells are insensitive to insulin, our body releases more insulin into the bloodstream so that eventually that sugar will go into our cells and we'll have energy.
So you're saying more physical activity then makes this process work better?
Yes, increased muscle mass along with physical activity in itself increases your cell's sensitivity to insulin. Why is this so important? High insulin levels and breast cancer risk are linked. High insulin levels in our blood. So exercise decreases inflammation. It improves our immune system function. Does this sound familiar to kind of some of the stuff we talked about with microenvironment? I mean, it's all linked. And it decreases the risk of pre and postmenopausal women for breast cancer. So exercise is huge. So you're thinking, okay, well, you told me I need to do exercise. What do I do and how much do I need to do?
My next question.
Carol, here we go. So 150 minutes of moderate activity per week or 70 minutes of vigorous activity. Moderate activity would be walking, maybe out for a nice bike ride, household chores, mowing the lawn, gardening, those types of things. Exercise that you can maintain a conversation through is generally deemed moderate. 150 minutes per week is roughly 20 minutes a day. So I think that's definitely doable for us, even if it's, parking the car a little bit farther away from the building and walking in. I mean, that counts.
Well, and you know, in my work, I work at a desk. So I really make a point of using the stairs, walking, you know, back and forth from my office to the hospital, maybe a little more often than usual because I like, well, my iWatch does kind of tell me if I need to move, which is amazing sometimes, but I do like that reminder, so I haven't turned that feature off yet, but it's that kind of exercise that I need to be reminded to remember to, yes, get up, get a little bit of exercise.
Yes.
20 minutes a day isn't too much.
No. And then vigorous activities would be where you're really not able to carry on a conversation. That'd be running, riding a bike fast, playing a sport, for instance, maybe you're playing soccer, those kind of things. I think some aerobics classes, different activities that really get your heart rate up and you're really feeling it. Vigorous activity, that's 10 minutes a day. 75 minutes a week is roughly 10 minutes a day. Now you don't have to do this throughout every day, 7 days a week. You can do a little here, do a little there. It is important to not do your whole 75 minutes in one day. Consistency is key. That's what's going to help your body and your microenvironment to change, and muscle to develop. So muscle strengthening actually is recommended as well for at least 2 days a week. And when we're first starting to work out or first increasing our physical activity, even climbing the stairs counts as moderate activity, but it also counts as muscle strengthening because our muscles aren't going to be used to that. And so that can be counted when you're first doing physical activity. But.
Oh, good advice.
So the last thing that we need to do is stop smoking. If you're smoking and you're like, oh, well, I only smoke half a pack or I decrease this much, it still is associated with a higher risk of breast cancer. There are several smoking cessation programs out there. American Cancer Society has a smoking cessation program. Smoking also can cause lung damage during treatment of breast cancer, especially with radiation treatment. That can make it more difficult during the treatment. And it can also affect your healing after breast surgery and reconstruction. So it's really important to remember for preventing, but also during and after breast cancer diagnosis.
It's a hard habit to break, I know, but recent studies and years of education from people like you let us know it's really something. Work on breaking that habit.
Yes,
yeah,
definitely.
Yeah.
So just to sum up, we've talked about diet, we've talked about weight and weight management and physical activity and smoking cessation, and those are all things that directly affect our microenvironment. And so our goal, our wish for the audience today is that you feel empowered by one or more pieces of information that we've given to enhance or change your microenvironment. Every little bit counts, and we hope that you have felt inspired.
Well, thank you so much, Jen. Really great information, and I appreciate so much the way you've opened my eyes to some of those things, especially about that microenvironment. That was just key for me.
Good.
So we do have a few minutes left, and I just wanted to encourage our audience to submit some questions. If you do have any questions that just might be sort of, occurring to you that you want to ask Jen, she's a great resource for just a wealth of knowledge. And so, but in the meantime, while you are submitting your chat questions, I did want to let you know that we do have a polling question. The polling question for today is, how likely are you to change one thing in your diet or exercise routine as a result of attending today's webinar? The choices here are A, 0, not at all. B, 25%, I think I might think about it. C, 50%, I'm on the fence, but it might happen. And D, 100%, yes, you have convinced me to make some changes. So as our audience is engaging in the polling question, I just wanted to call the audience's attention to a few things about EFY. As you may have heard, especially for you, race is virtual this year. It is the 30th annual EFY race against breast cancer, and there's still time to register for the race. You can register for the race through the EFY website, which we will show you in a minute. Usually we have 15,000 people who register for the EFY race. This year, because it's virtual, I was concerned, being on the steering committee, that maybe people wouldn't be so excited about EFY, but I have been so very happily surprised that we now have 400 teams approximately, and 10,000 people have already registered for EFY this year. So
that is amazing.
It is, yeah. It's such a good cause. And the best thing about EFY, not only is it fun, not only is it something we routinely do with our friends and our family and our community, it is supported by so many across the community. But it also supports the EFY fund, which then allows people who may be concerned about the cost of breast and gynecological cancer treatment and screening. It helps so that simple one-sheet application through the EFY website, and people can get some help with with the cost. So I'm really happy about that. And so just as you know, that when you pay your registration fee for EFY, you are also supporting the EFY fund. And we endeavor every single year to spend all of our money. So we try really hard to be available to support community with the fund any way we can. So we do have a little video that we wanted to show you, which just kind of explains a little bit more about EFY. And continue to fill out your polling questions.
Registering for the EFY virtual race is simple. Just go to the website. You'll fill out a form and tell us your t-shirt size. Cancer doesn't stop from COVID-19, and neither are we. Just as always, the race raises funds to help locally.
Come back to it. We can cut it. Oh, there we go.
You can run or walk the EFY race whenever you want. You can run or walk wherever you want. You pick the time and the course. You can run the race alone or at a safe distance with friends. Wear your EFY t-shirt proudly and be sure to share your race achievements by posting pictures and updates on social media. Check out the EFY website to get more information on fun and things.
All right. Well, I think that's a really fun reminder of why we do the race, and it is fun. So
It's also a great way to increase our physical activity and alter our microenvironment.
absolutely,
So,
yes. So we just have a few more questions for you, and I just will check the chat just to see what people have, what kind of questions people have brought to you. One question that comes up is, sometimes I've heard that women's breasts are different sizes. And I think I know when I've heard this, I haven't always known the correct answer. Is this a concern? Is this something that a woman should take to her doctor? If it's all
As far as between a difference in size between each of their breasts. You know, some women may say, oh, my left breast is larger than my right, but it really shouldn't be noticeable. It really shouldn't be noticeable at all. If you notice that one breast is growing and changing in size, that would be something to definitely bring to your provider and talk about. Absolutely. Yes, yes. Don't be ashamed. This is, I mean, we're talking about our breasts after all. They're important. And it's our lives. So bringing that up is always good.
What about organic versus non-organic? Is there that important thing?
So as far as eating organic produce in comparison to non-organic, studies have shown that it doesn't increase, it doesn't give you health benefits, so to say. However, you are exposed to less pesticides, chemicals, those types of things. It's better for the environment. I personally, if organic is available, I buy it because I think it's important, at least for me and my family, to express our consumer voice. But as far as breast cancer risk, if you're eating produce, you're eating the vegetables and fruits, that's the main thing. It's more your choice whether you prefer to maybe spend a little extra and buy organic and for individual reasons. Absolutely. Yes.
So one other thing I think about these things because I really enjoy eating. I enjoy cooking. So
Me too.
so are these foods that you're recommending to us, do they have that? And does my
You know, what I would say is you don't have to eat like a rabbit to prevent breast cancer. It can taste good. I think those of us, we had an employee luncheon, an employee appreciation luncheon actually just yesterday, and there was a kale salad served there. And it was really good. It didn't taste like it was kale. It was really good. And as I said, putting it in smoothies, you know, raw is usually better than eating cooked. However, if you're cooking it, you're still eating it. So you can make some really good dishes. There's a lot of resources out there if you search, you know, good recipes for broccoli or for spinach, and there's all sorts of combinations of foods that when I look, I'm like, wow, that sounds actually really good. And we try it and then we incorporate it into our kind of regular cooking schedule. So,
raising a 3-year-old, what a good experience.
well, it's a battle. But it's a battle that we try to win usually.
So let's go ahead and see what So we have, so 11% of people answered the question 0, not at all.
Okay.
We had 5% who answered 25%. 21% of our participants answered 50%, being on the fence but might be convinced. And 63% of our participants said yes. 100% are going to change the one thing.
Yes, I think that's huge. That is part of reducing statistics. If there is further questions from anybody in the audience about resources and studies, there is at least, there's countless articles, but at least 50 studies that were referenced on this actual presentation that I would be happy to talk with anybody about. But yeah, I think, as we said, if we've convinced even one person, that is a big deal. So just knowledge is power.
Thank you so much, Jen, for sharing your thoughts with us and that great information today. We know that this webinar will be on the website, and so if you do have friends who'd like to watch in the future, just leave them to the website. And we just want to give a special thanks again to Jen Somerville for this educational program, to Mercy Medical Center for hosting this event, and for Mercy Marketing for spreading the word and getting this out to not only for our administrative team Zoom expert who is helping us with the webinar today, but also just with the administration for supporting us. I want to take a special opportunity to thank the sponsors of ESY. We couldn't do this work without the community sponsors. We will have another webinar in 2 weeks. Jen and I will be back on Friday, October 9th for another webinar for breast cancer screening and treatment. So I just want to encourage all of you to get that on your calendar and to set aside some hours of your for that as well. That will be race week. The ESY race is scheduled for Sunday, October 11th. It will look a little bit different this year than it has in the past in the original race, but we're still really excited to have race week coming up. And I think Jen and I will be wearing our race t-shirts
Absolutely.
next time we get together. So thank you so much for joining us, Jen.
Thank you.
Everyone